At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during this session, you will want to press *1 on your telephone. Please be advised that today's conference is being recorded. If you require any further assistance, press *0. I would like to now hand the conference over to your speaker today, Mike Schomer. Please go ahead, sir.
Thank you for joining us for the COVID media briefing call for March 15th. We have a number of speakers today, so I'll run through the order really quick and then we'll turn it over. First, we have Commissioner Malcolm, followed by EHRESMANN, and then Assistant Commissioner Dan Huff. Following that, we have three guests who will be speaking. HEIDI, who's the head coach of West Express Swim Team, GLEN ANDRESEN, Executive Director of Minnesota Hockey, and Kevin BORG, Superintendent, West Tonka Public Schools. With that, I will turn it over to Commissioner Malcolm.
Thanks, Mike, and good afternoon, everyone. Just a quick reminder about the global and nationwide situation to start off with. We're now above almost 120 million COVID-19 cases around the world as of this morning, which is up 321,000 just in one day. And we're over 2.65 million deaths worldwide, an increase of over 5,200 from the day prior. The United States is now above 29.4 million cases, an increase of 37,000 from the prior day, and 534,889 total deaths, an increase of 574 over the day prior. I mention this just as a reminder that what goes on around the world and across the country certainly affects us here in Minnesota in terms of eventual control of the pandemic. Here in Minnesota, we reported 1,191 cases on Saturday, 994 cases on Sunday, and 829 cases today, for a new total of 498,218 cases since the beginning of the pandemic a year ago. Each of those prior 3 days came on reducing test volumes each day. For instance, today's 829 positives came on a test volume of 16,417 lab tests. The change that we see in the growth of our cases, it has increased over this week compared to the prior week. It's 1.6% increase in cases week over week compared to 1.1% the week prior. However, the weekly change in testing is going up at a slower rate than the prior week. 2.5% more tests conducted in the prior week, down from 3.4% more tests conducted a week in advance. Our 7-day average testing positivity rate is remaining at 3.6%, which is below the caution category. Unfortunately, we reported another 4 COVID-19 deaths on Saturday, 5 more on Sunday, and 1 additional death today. We're now at a cumulative total of 6,747 deaths since the start of the pandemic. 260 people are currently hospitalized in Minnesota hospitals for COVID-19 care. Of those, 59 are in intensive care. We have seen an increase in hospital bed use over the past week. Just as a reminder, with the governor's dial turn announcement from last week taking effect today, while we're all pleased to see things moving in the right direction, we need to keep our eye on the fact that there's still a lot of viral activity around our state. Our cases on a population basis are high and ticking back up a bit. So we just need to keep attending to those basic prevention steps that we know are so critical for helping to control the spread of the virus as we continue to make progress on vaccinations. We need people to keep up the good work on masking, social distancing, staying home when getting sick, and getting tested when appropriate. It's just really important that we keep up our testing so that when there are cases, we can find them and help to take the right actions to prevent the spread. On the vaccine administration front, we're very close to 2 million total vaccine doses now having been administered to Minnesotans, as shown on our vaccine dashboard. A reminder that this is a combination of first and second doses. The number of Minnesotans who've had at least one vaccine dose is now over 1.26 million. Over half of those, 725,000, have now had the complete series of COVID vaccinations. And with that, I'll turn it over to KRIS EHRESMANN to talk a little bit more about second doses. KRIS.
Thank you, Commissioner. Getting both doses of a 2-dose COVID-19 vaccine is very important to ensure the complete protection against COVID. When you get vaccinated, the provider will let you know if you need to come back for a second dose. The second dose needs to be the same vaccine product as your first dose. A CDC morbidity and mortality weekly report out today shows that we've been doing well with completing second doses, with 9 out of 10 people, or 90.5%, getting their second dose in Minnesota between December 14th, 2020 and February 14th, 2021. Of those, 95% got their second dose within the recommended interval. But of course, there's still work to do as we're aiming for 100% completion. As more people become eligible, we know it may be harder for some to complete the vaccination series. We are working with providers and local vaccination partners to help make sure systems are in place so people can get their second dose, ideally where they get their first dose. Second doses are still held back and they are delivered a few weeks later to the providers who gave the first doses so they can complete that vaccination series. When it's not possible for someone to get their second dose where they go first, providers are encouraged to complete a vaccination series they did not start when feasible. Patients should make every effort to get their second dose. Make an appointment for the second dose when you get your first dose, if at all possible. You want to get the second dose in the recommended time frame, but if it does have to be a little delayed, you will not have to restart the vaccination series. But do get the second dose as soon as you can. If you cannot get your second dose where you got your first dose, reach out to your healthcare provider and get on a waiting list with them for a second dose. If your provider does not have the right vaccine product, you can find other providers with COVID-19 vaccine at Find Vaccine Locations map on the state COVID-19 website. And if you cannot find a provider to get your second dose, contact your local public health department. And with that, I'll turn it over to Assistant Commissioner HUFF for a variant update.
Thank you, KRIS. Today, I'd just like to spend some time for an update on the B.1.1.7 variant and its presence here in Minnesota. The variant was first identified in Minnesota in January, and since then, we've been actively testing samples to detect for more variants. There's still a lot to learn about the B.1.1.7 variant, and we are working with our partners to continue to track the spread of the virus. Early data suggests that the B.1.1.7 variant is up to 50% more contagious than the original virus. It spreads much easier than the original virus, meaning even with our best mitigation measures, the virus will seek any opening to spread. There is also concern that this variant may be associated with more severe disease. Of course, research to confirm these findings is ongoing. And while the vaccinations have continued to stand up well to the variants, we are still learning how B.1.1.7 will affect our vaccination efforts. As of today, we have identified more than 250 cases of this B.1.1.7 variant in more than 24 counties in Minnesota. We are very concerned about this variant and its rapid spread. It has the potential to be a setback to our continued and hard-fought progress against the virus. We continue to monitor a cluster of these cases in the Southwest metro area. We first identified these cases in Carver County, which reported an overall weekly case growth of nearly 80% from February to March. Case rates are now approaching rates seen in October of 2020, with roughly a third of these cases being found among young people or people under the age of 20. We have now identified 140 epidemiologically linked cases of COVID-19 as part of this cluster. And upon analysis of the available samples, we have found 32 of these cases are confirmed to be the B.1.1.7 variant. 67 of these cases are pending additional analysis and whole genome sequencing. In 41 of these cases, we are unable to sequence. Either we were unable to get the sample from whichever lab it was sent to, it was an antigen test, or the sample just wasn't a high enough quality. The initial cases were primarily tied to Eastern Carver County and connected primarily through youth sports and recreation. The spread and continued transmission is then happening in households, as well as the broader community connected to youth sports, including fitness centers and recreation facilities, schools, at least one child care facilities, and now local businesses. Now, I want to remind folks that this is not because our schools or our coaches or our student athletes, or for that matter, Carver County, are a problem. The problem is the virus and this more contagious variant of the virus. What has happened in Carver County can, and unless we act to stop it, will occur throughout the state. We are responding aggressively. The state, with support from the National Guard, is operating a temporary community testing site at the Chanhassen Recreation Center. It was open last week. It will continue to be open this week, Thursday, Friday, and Saturday. And we recommend everyone in the community to go get tested, either at this Chanhassen rec facility or one of the many community testing sites we have in the metro area. Due to this growing outbreak, it is important that everyone in the community go get tested. This cluster is why we recommended a 2-week countywide pause in youth sports and associated social activity for Carver County until March 21st. This temporary pause is an effort to contain the spread of this B.1.1.7 variant. If school teams or club teams choose to not pause activities, we strongly recommend implementing a rigorous weekly testing protocol, including before and after games, from now through the end of the year. But it's not just youth athletes from areas with higher rates of cases that should be getting tested regularly. We need all young people and children who are interacting outside of the household to be seeking out, or for their parents to be seeking out on their behalf, regular testing. Each week, more and more of our students are returning to the classroom, resuming youth sports, other extracurricular activities, and getting back to their life. But as the numbers continue to improve statewide, we are seeing the lifting of more restrictions. Those changes from the governor are a result of the hard work and the progress that we are all making. But to protect this success, we need to remain vigilant. One of the most important ways we do that is through regular testing. Not just when we're feeling sick or learn when we've been exposed, but definitely then, but also on a regular basis. We recommend that all youth involved in sports or in activities where social distancing is difficult to get tested every week and 3 days prior to games or matches. Children in in-person learning and involved in other extracurricular activities should get tested every 2 weeks from now until the end of the school year. And we encourage families to test with their children. Again, this is not just for places that are experiencing current high case rates or the B117 variant. If we're going to stay ahead of this, all young people across the state should be getting tested weekly for athletes and every 2 weeks for non-athletes. It's how we avoid more pauses in sports and how we keep our kids in the classroom. Our educators have been participating in regular testing for several months now, and we ask them to continue to participate in their school's testing program even after vaccination, so that they can act as asymptomatic carriers and bring this new variant in their communities. Again, teachers should continue to test even after vaccination. For our students, testing has never been easier. There are community testing sites all around the state. We have pop-up testing sites. And of course, we have our at-home saliva testing through Volt. Students are now able to send their saliva at-home test kits just to their schools. Schools will collect those and return them back to the lab with the educator testing samples. So you can order the test for at home. Parents, you can help your student take that test, and then you can send your student to school with the test instead of having to find the UPS drop box. We're so close to the light at the end of the tunnel. And as we see record numbers of vaccination around the country, right here in Minnesota, we realize how much progress we've made. But this thing's not over. We need everyone to keep following the mitigation measures we've relied upon. Masking, social distancing, staying home when we're sick, and testing. We appreciate how many coaches and how many teachers and how many parents are taking this to heart and leading on this issue. We have some of them here with us today. I am honored to be with you today with these community leaders, these folks who dedicate their lives to our young people. First, I'd like to now turn it over to Heidi Myler, who's the head coach of the West Express swim team. Heidi?
Hello, everybody. Thank you for having me. Our team is based in Chaska, Chanhassen, Victoria, and also we have Laconia swimmers as well. I can attest to the fast-moving nature of the variant because I was at practice on Friday, March 5th, and then all of a sudden I got home and this was not on my radar at all, and all of a sudden my phone was blowing up and heard from a number of people saying, have you seen that youth sports are going to be recommended to be closed? And indeed that did happen on that Saturday, the 6th, which was very hard for our team. We're right in the middle of our championship season. We had 2 weeks leading up to our final meet, which was going to be this coming weekend. And it just kind of, it was definitely a gut punch to everybody on the team, our parents, our swimmers, the coaches. We've all been working hard since our January start. But we have been keeping positive, saying this is almost the end of it. We will really hope to be back to some normal activities, normal meets, the regular style swim meets in when parents can actually watch, starting in the spring. But I will love to shout out to our Minnesota swimming community and our team for their amazing efforts of following our protocols. We have not had a single COVID case at pools throughout the pandemic. So I think our masking, wearing a mask to and from the pool, we social distance at practice. We have less people in our lanes than normal. We haven't been using locker rooms. We haven't had spectators at our meets. All of this has really helped to mitigate the COVID at the pool. So we're just really looking forward to getting this beyond us. And we are really thankful that everybody on our team and swimming in general have remained positive. And just want to keep getting out the message, keep testing, keep wearing your mask, keep doing what you need to do. And before you know it, we're going to be back to normal. And that's what I have. And I was going to pass it on to Glenn.
Thanks, Heidi, and thanks to the Minnesota Department of Health for having me and helping us get to this point of our season. I'm Glenn Andresen, the Executive Director of Minnesota Hockey, which is the governing body of all the youth and amateur hockey in the state of Minnesota, with the exception of high school hockey, which falls under the state high school league. As I'm sure everyone on here is aware, it's been a long season for winter sports, and a lot of challenges for the youth athletes that participate in them. Just as it's been a challenge for everybody in society. But the finish line for us in hockey is near. For our youth season, we end in 2 weeks with our state championships held the weekend of March 26th to the 28th, and then the high school season ends shortly after that. And we just want to urge all our teams to do whatever it takes to get us to that finish line and get us across it, while staying safe, while keeping the community safe, and while keeping all the teams that are still going safe. We've had a lot of teams end their season already, either just by being eliminated or by some shutting down, especially in Carver County, due to the pause. And so we want to thank all those teams for their efforts to get us here as well. And for the teams that are continuing to play, we certainly hope they enjoy these last 2 weeks, but also do everything they can to stay safe. And whether that means, refraining from those fun things like getting together with your team before or after going to the rink, keeping the masks on, coming to the arenas fully dressed and not using the locker rooms when possible, and just really following the guidelines and using all the tools that are out there to keep their teammates safe, keep their families safe, and again, to keep the greater community safe. So use the tools that are out there and get tested. And of course, if you're not feeling well, don't go anywhere near your team throughout the rest of this season. So that's all I have. And I will again thank you to the Department of Health for helping us get to this point of the season, and we're just excited to get to the finish. I'll hand it off to Kevin BORG, the superintendent from West Tonka Public Schools.
Yes, this is Kevin BORG. Just would want to start by just saying how much we appreciate the efforts by everyone that allow us to have students back in school. The importance that this holds for our students and for families and for our educators, it's really hard for me to express, but we just know that there's a lot of sacrifice that's been made by many, and so thankful. Those of you that aren't familiar, West Tonka is on the west side of Lake Minnetonka, Mount Minnetrista. At West Tonka, we've been operating in-person K-4 and hybrid 512 since late January. Our road to be able to do this, we feel very fortunate that vaccines were prioritized for educators that allow us to keep our staff in the building. At this time, nearly all of our staff have had at least the first vaccination. And so we, to the state, we really feel blessed that educators were prioritized and that we are allowed to do our jobs and working with our kids. I think also we appreciate the expanded efforts around testing. And as mentioned earlier, every other week we've been able to offer testing here at West Tonka for our staff. And last week we got news of how that we can help students in sending in their saliva tests. And so we've sent that communication out to our families, and we'll start working with them. I think, and this I'm sure is representative in a lot of school districts across, but I'm really amazed at just the incredible compliance that our students and our staff have shown in mask wearing and communicating if they're not feeling well, and also with social distancing. Our ability to stay open would not be in that place if it wasn't for our staff and students having that compliance. And we have a lot of school districts that are in a similar place to our district now of being able to offer in-person education. And so whether it's Westonka or other places, our students and our staff have really stepped up to put us in the best position that we can be to be offering in person. Lastly, we have a great nurse team, and our district nurse, Kelly Matson, when you signed up to be a district nurse, you never knew you're going to come into this role, and how she has led our district with communication and the sincerity of the efforts of contact tracing. To all the nurses across our state that have been working with us administrators, their effort and their dedication has been nothing short of remarkable. And I think our help with MDH as we do that contact tracing, I also lift that up as a reason why we can be in person. And we don't take this for granted. We know that that could change. I liken it to what we just looking out the window and looking at the snow. We found out yesterday we didn't think as much of this forecast was going to hit the cities, and this morning all of a sudden we were more involved in this, and trying to make decisions on keeping our kids safe is a very fluid situation, whether it's weather forecast or whether it's COVID. And so we don't take it for granted, and we know we have to stay diligent. And I think the efforts of expanding vaccination, the effort of expanding testing is efforts that allow us to continue to push with mask wearing and not letting up so we can see this year through. It's our greatest hope that when we look at being a year out now, we want these games to happen for our kids. We want these events to happen for our kids, and we want to bring our kids back in our building. And so many thanks to all the people that have allowed us to get it to this point. We don't take it for granted. We know it's a fluid situation, and yet we're really hopeful, and we're going to continue to work that we can stay in this place. So I'll turn it back to Mike.
Thank you, Superintendent Borg. Operator, we're ready to open up for questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, please press the pound or hash key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open.
Yeah, hi. Commissioner, last week you had said, that not all variant outbreaks are going to be the same or as concerning if they don't result in hospitalizations and deaths as a component. Just more illness may not be a thing that we need to be terribly concerned about. I'm wondering if you guys have any information now about the current outbreak in Carver and surrounding communities, whether it's producing severe illness, hospitalizations, and things like that, or not.
Thanks, Jeremy. I'll ask KRIS EHRESMANN to comment on anything we do or perhaps don't yet know about the consequences of the increases in cases that we're seeing. That's certainly what we'll be watching for. And it is absolutely true that whether the cases produce the same pattern or different pattern, more or less, because of the variants and the vaccine, will be very important. But we also do know that just more cases are a problem, in the sense that the more cases that are out there, the more this virus replicates, the more chance there is for additional variants to pop up. So it does remain a statewide, nationwide, and global imperative just to try to keep the case growth under control, so that we don't keep fueling this increase in variants. But in terms of what we're seeing in Minnesota, KRIS, is anything that you would add yet? It might be too early to say.
Yeah, well, we certainly we have had 12 individuals admitted to the hospital. Of those, 2 who were admitted went to the intensive care unit, and both did die. And data from the UK suggests that the variants are showing themselves to be more severe. So it is something that we're continuing to monitor here in Minnesota, but we have seen some severe illness associated with the variant.
And as a follow-up question, if this gets out of the barn, for lack of a better term, and the variants do start to spread more widely, we have our seniors fairly well vaccinated, educators, long-term care residents. One group we don't is minorities and those underrepresented, some of those populations right now. Has there been more discussion about kind of amping up vaccinations in those populations that so far are kind of behind?
Well, I think as we announced a couple of weeks ago, we do have an increasing number of strategies. We're building on the ones we've been using, like our work with federally qualified health centers and additional community health centers, community pharmacies that are located in areas with a higher social vulnerability index and so forth. So while we've been doing some things all along, we're doing more of it and adding more strategies to the mix. Things like more community-based vaccinations sites stood up in partnership with community-based organizations, mobile vaccination approaches and the like. So it's a both and. We're continuing to build out what we've been doing and adding more to it, and now having better data is going to really help us measure more precisely where we're making progress and where we have work to do.
Thank you.
Your next question comes to the line of Catherine Richard from MN Public Radio. Your line is now open.
Hi, yeah, I mean, can you just give us some sense of how many teams have actually stopped playing? If it's a uniform shutdown in Carver County, or whether most teams are still moving ahead in spite of this outbreak? Where does that stand?
Tia, do you have any insight into numbers?
Thank you, Commissioner. I do not. I do not know specifically which teams have paused. But as Glenn mentioned, and as I have mentioned, and we are getting really good support from all of the teams in implementing additional mitigation measures. You know, I think what we have to look at with COVID, and I know other people have talked about the sort of the Swiss cheese model of prevention, where you have to line up a lot of slices of Swiss cheese to fill up the hole. And that is why we're asking for comprehensive mitigation measures. The goal is to stop this variant from going from person to person. And that's what's happened right now in Carver County in this community. It's just been hopping and keeping going. So what we're asking, is to really stop the outside social activities, no team dinners, no kids sleepovers, no getting together before or after practice, to limit every possible interaction we can, to increase our testing, to increase our screening, our making sure that we are indeed, letting the coaches know if we're not feeling well, so we don't infect other folks, and encouraging that pause to limit the time where we're interacting with other teams as well. But we do not have an exact number of how many folks are doing which or all of these mitigation measures. Thank you.
So just to follow up, bigger picture here, I sense a lot of concern on this call today, and we have the governor saying that things are looking good, we're reopening. Up to 10,000 people might be allowed to gather at Target Field in a few weeks. Meanwhile, we're also hearing that, this could really explode pretty quickly, and is already moving in the direction of raising some alarms. For you guys, how should people make sense of what seems to be these conflicting pieces of advice here?
Well, I appreciate the question, but I don't think they're exactly conflicting as much as kind of need to be understood in parallel. That as there's lots of reasons to indicate that we are making good progress, we still have these vulnerabilities, and we know that as we increase our interactions, those prevention measures are very, very important. So it's really just I think the message is to keep making this progress. We all have to keep up those basic prevention strategies, especially with the variants. And we're just, as we've said a couple times, really trying to stay ahead of the variants by making sure that we do practice good mitigation and that we get people vaccinated as quickly as we can.
And Commissioner, may I add to that? I think the superintendent mentioned about the snow today. So the governor has opened up the road, but the governor didn't say drive 70 miles an hour without your seatbelt. What we're saying is we still have to be careful. It is still, the roads are still slick out there, and we have to be cautious. So yes, we are beginning to open up because we see great progress, but it doesn't mean we go out with willful abandon. We still have to be smart so that we can keep this progress going.
Okay, thank you.
Your next question comes from the line of Joey Peters from Sahan Journal. Your line is now open.
Hi, thank you. My question is about vaccine distribution in areas high on the social vulnerability index. Because last week, Commissioner, you had indicated that providers can distribute the vaccine to people in high social vulnerability index areas even if they fall kind of outside of other eligibility factors. And I'm just wondering if the state is kind of tracking or kind of knows how frequent such distribution efforts have been since the opening of that. If that question makes sense to you.
Sure. That was specific to the federally qualified health centers with whom we're working and a specific set of community pharmacies who are in some of these areas. We can certainly get back to you with more of a qualitative report on what those pilots, if you will, are showing. We really just have been working on that basis with a few of those providers for a few weeks now. Although I would ask Chris, I don't know if you have any more specific data than I do at this point, but if not, we can certainly come back to that question.
No, it's as you said that there are selected vaccinators who are working with us to reach out to particularly high risk populations and populations of focus, but I don't have anything more granular than that.
Okay. My other question, whether you can answer or not, is the state offering guidelines in these instances on do areas where these distribution efforts are happening, do they have a minimum where they have to rank on the vulnerability index, or has the state offered guidelines on where exactly on the index areas have to rank for this to happen?
I think it was really, but again, Chris, feel free to correct me. I think it was more kind of categorically the providers that are working in those areas, and
okay,
right.
We have been using. Yeah, go ahead, Chris. Sorry.
I was going to say that the providers that we've been focusing on are those that are serving those populations of focus and are serving populations who are more would be more in locations where we see greater social vulnerability. So hopefully that helps.
Okay. Thank you.
Operator, we have time for one more question.
Your next question comes from the line of John Shipley from St. Paul Pioneer Crest. Your line is now open.
Hi, thank you. I'm wondering that we're so close to the vaccine, and we're so, to more people getting vaccinated and maybe becoming normal. I'm wondering why you haven't made the decision to just maybe stop sports for a couple weeks, to try to mitigate, especially this variant spread.
Well, I think, I'll this is Jan, and then Dan, if you want to comment, certainly jump in. I think, the emphasis here has just been on getting people good information about the elevated risk and encouraging this to be done on a voluntary basis, or if not, to really pay attention to these enhanced mitigation protocols and the importance of testing. it's so critical that people do get tested and then take appropriate actions if indeed they are positive. So it's thought that this would be a kind of a more targeted way of responding to the situation. Because I think, we just want to make sure that people have full appreciation for the fact that there are risks and there are things they can do to mitigate the risks. And anything else that you want to add?
Oh, no, Commissioner, I think you hit it right there. There are risks, and we work to mitigate those risks. We're in a global pandemic, and when we interact with anybody outside of our household pod, there is risk. The more people we interact, the more vigorous we interact with people, then there is increased risk that way. So we look at how do we mitigate that risk, and that is why we are saying, limit extra exposures. Keep testing, really buckling down on masking and social distancing. But we also understand that we are all whole people, and we are balancing many aspects of health, emotional health, mental health, physical health, as well as this pandemic. And our goal is to be as open as possible without creating increased risk for everyone in our state, as we saw happen so quickly back in around Thanksgiving, when we hit exponential growth and our hospitals became strained, and it was very much a crisis. So it is about using these smart measures to make sure that we can continue to do things as safely as possible while acknowledging that when we are interacting during a global pandemic, it carries risk.
And then if I could follow up real quickly, I was looking at the Carver dashboard for total cases, and it's really just gone up and up and up. There's no plateau there. How do you have any sense, like for Carver or anywhere else, how much of that is due to the variant, or is it still too early to suss that out?
Well, I think with the epidemiologic investigation that's been done, we do know that the rate of spread, and the degree of spread within groups that were exposed to the B117, whereas we might expect to see 10 or 20% of a group that was exposed actually actually test positive. With the B117, we're seeing 80% or more of a group that was exposed to actually develop COVID. So we do believe, that as Dan laid out, there's some of this community-wide spread has been increased by B117. But Chris, would you add anything there?
Yeah, I would say that the fact that we're seeing so much B117 and we're seeing, we know that contributes to increased transmission. I think those are all things that we're thinking about as we do see cases increase. However, we don't have the level of granularity with surveillance for B117 to speak to it specifically. So I think we would say that we're seeing increasing evidence of B117 transmission. We know that it is more transmissible, this variant. And so certainly as we see increased cases, the likelihood that they may be B117 is certainly there. But as I said, there are limits to our surveillance, so we have to be cautious in exactly how we, describe the situation.
Okay, thank you.
All right, that is all the time we have for today's call. We thank our guests for joining us today. Any reporters with additional questions are encouraged to contact our office this afternoon. Have a good day, and we will be back with you again soon.